Good afternoon. This is Peter Thomas in Washington, D.C., NAAOP's General Counsel. Early December has been an incredibly busy time in Washington as Congress heads towards the doors and closes the 114th Congress. And the Trump administration is in transition and is naming new secretaries and cabinet officials almost every day. At least four major issues have occurred this week. First, the district court in the District of Columbia has issued a decision in the American Hospital Association case involving the backlog of administrative law judge opinions, ALJ hearings, and it's favorable. This is great news. What this means is that the Department of Health and Human Services is now mandated by the court to reduce the backlog by 30% by the end of next year, 60%, 90%, and 0 by the year 2020. This is tremendous news. This will accelerate and put major pressure on the department to settle cases and to move the backlog much more quickly than they have been. Currently, the average time it takes to get a Medicare denial through an ALJ hearing and with a decision is 832 days. And the statute says that those decisions need to be made within 90 days. So that is tremendous news. It does not yet have a direct impact on orthotic and prosthetic claims, but stay tuned. We're quite confident that it will. Second and very important issue is an announcement that occurred early this week from the Agency for Healthcare Research and Quality. And they are seeking information on a questionnaire that seeks to develop and assess the evidence base for lower limb prostheses. This is a questionnaire that can be answered by anyone, but frankly, we don't need quantity of comments on this one. We need quality. We need real researchers and learned clinicians and academics to really get into these questions and to advise the Agency for Healthcare Research and Quality on these very complex questions. The OMP Alliance, NAAOP, and all of its members, including allied health organizations and the Amputee Coalition, are all working on responding to this questionnaire. It's an important evidence-related question that will hopefully serve us well into the future. But it's not without threats. If these questions are not answered in the right way, we may not be able to demonstrate to a sufficient extent to payers the evidence base for lower limb prostheses. So that's an important development. The comments are due December 20th, and we're working very hard on it. The third issue involves orthotic and prosthetic legislation that I've talked about in the recent past, and that a number of OMP groups led by AOPA has been very active over the last several weeks and months in trying to push across the finish line. Unfortunately, there was no Medicare vehicle that moved at the end of the year, and there was no ability to get some of the OMP provisions tacked on to that bill, or the bill, because it didn't move. But there were important gains made. I want to thank Tom Feist. I want to thank Tom Watson, who really reached out and asked some of his representatives and senators to personally intervene. I want to thank Bob Kerrey, former Senator Bob Kerrey, who went above and beyond in trying to get these provisions included in the bill, in any kind of legislation that moved at the end of this Congress. In addition, Tom Feist's and AOPA's consultants were invaluable in trying to move this legislation forward. I was on the phone with them almost every single day in the end. The OMP organizations were fantastic in writing to Senator Grassley and to Glenn Thompson in the House, our chief sponsors, and they were incredible in trying to move this forward. In the end, we've made huge gains, and I think we'll be well positioned next year to make legislative victories in the orthotic and prosthetic field, but there simply wasn't a vehicle to tack those things onto at the end of this year. And then finally, some very positive legislative news. A bill that NAAOP has been working on for a long time in conjunction with a coalition called the Disability and Rehabilitation Research Coalition was passed and included in the 21st Century Cures Act, which should be signed by Tuesday. This bill would enhance the stature and improve coordination of rehabilitation science at the National Institutes of Health. There are 27 institutes and centers at NIH and a number of other federal agencies that do fund and support rehabilitation science. And a large part of that is the OMP research funding stream, not just from NIH, but from other federal agencies as well. So we're grateful that this legislation passed. The NAAOP was started in 1987 on a research issue to establish the National Center for Medical Rehabilitation Research, and this bill relates directly to that agency, the research priorities of that agency, and the OMP research agenda. So we'll end the year on a very positive note. It's been an incredibly busy year. We look forward to the new Congress and the new administration in 2017. Thank you very much.